Acting Chief Medical Officer Dr. Francis Martin says that several employees at the Maurice Bishop International Airport, the MBIA, were advised to self-isolate after a confirmed positive COVID-19 patient left Grenada for the United Kingdom without health authorities' notice. In an interview with GBN on Thursday, Dr. Martin said that the people contacted are cooperating with health officials and are not experiencing any symptoms at this time.
Inadvertently, persons who were exposed to him during that process were workers at the airline counter and security officers at the airport. After recognizing what has happened, our contact tracing team headed by our epidemiologist moved quickly to identify with the airport management, identify the staff that were directly involved. Surveillance video was used to identify the exact staff that was involved, and the staff involved and in contact are now under self-quarantine.
Dr. Martin was unable to say how many people are self-quarantined as a result of exposure by that UK patient said to be in his 50s. However, he said he believes they are low risk.
They were all wearing PPEs. And when I say personal protective equipment, I meant equipment that is used in situations like these for dealing with those types of cases. So after investigating their use of the PPEs and the processes that took place, while we do have them under quarantine, it was the circumstances was a minimal risk. So I am really hoping that holds true and that they do not develop any symptoms and that they do not get a positive test.
Meanwhile, Dr. Martin says they await one pending test result sent to CAFA and that the RSS was requested to provide transportation on Thursday to send additional samples for testing. Regarding concerns surrounding self-quarantine and the question of why the government's quarantine centers are not being used for people tested positive for COVID-19, Dr. Martin told GBN all options are on the table.
When we started this process, we self-quarantined some that fit the bill to be self-quarantined, and we mandatory quarantined those of others that we thought needed to be mandatory quarantined. By and large, this has worked really, really well up until this particular rogue case. That was not a case that we thought would do whatever happened. But like I say, it has the circumstances has changed, and the discussion is going to continue to change. As of this morning, again, we start looking at the feasibility of mandatory quarantine, and this event has put more pressure on us to make a decision as to what the best way to go forward in terms of quarantining these people.
Dr. Martin says to date there are between 7 to 9 people in mandatory quarantine and expected to be out in a matter of days. And the amount of people self-quarantined through contact tracing to date is between 80 and 100. The 50-year-old patient 0 is said to be doing well at home, remaining in self-quarantine. Cherry and Blackman Stephen, GBN News.